Let's briefly talk about the components of your daily note as a student or as an intern or resident. We call this daily note the SOAP note, and it stands for Subjective, Objective, Assessment, and Plan. And exactly as it sounds, these four elements make up your daily note. And so let's just break these pieces down so that you have an idea of what is an appropriate SOAP note. So let's talk about the subjective piece. The subjective pieces include review of systems, so does the patient have a headache? Does the patient have chest pain? Does the patient have abdominal pain? Does the patient have a fever? Etc. And the review of systems can be tailored to the patient presentation. So if the patient came in the night prior with a urinary tract infection, you can ask the patient, do you have suprapubic pain? Additionally, in the subjective portion are the events. So the events are very important. You need to know, you need to document what happened overnight. So the patient spiked a fever, or the patient's urine output dropped, or the patient's hematocrit fell, or the patient's creatinine went up, etc. Those two pieces make up the subjective portion of the SOAP note. The O stands for objective. Objective is a telling of the facts. And so those facts are vital signs, and the vital signs include the temperature, include the heart rate, include the blood pressure. These will be measured. The heart rate and blood pressure are measured by the Dynamap, which is an automatic blood pressure and heart rate machine. The temperature is measured, obviously, by a thermometer. Commonly, you will also see respiration rate written down. And the respiration rate that's written down is always wrong because it's not actually measured. So the respiration rate is usually estimated, and it's estimated at 20. And I would contend that 20 breaths per minute is tachypnea. And so don't write 20 down. If you haven't actually counted the respiratory rate itself, don't write it down as a vital sign because what you're writing down is actually wrong. Some people will also include the SpO2 in their vital signs. The SpO2 arguably is or is not a vital sign classically. However, it is so commonly measured that it makes it into the objective piece of the note because it is an objective piece of data. The other part of the objective piece of the SOAP note is the exam. And this is your physical exam based on your observations. This is your objective observation. So in terms of the patient, you can do either a focused exam or you can do a more expanded exam. And it all depends on the patient presentation. It all depends on why the patient is in the hospital. But in general, a focused exam is preferred simply because you need to examine the patient's abdomen if the patient came in with abdominal pain and there may be a question of a surgical abdomen. You probably don't need to focus on the facial exam if the patients come in with a surgical abdomen. In addition to the objective vital signs and exam, we also have the data. And the data is something that you will find is extremely important, especially in modern medicine. And the data will include the Chem7 and also the CBC. The Chem7 is documented as such. With the sodium, potassium, chloride bicarb, BUN, creatinine, and glucose in what we call the fishbone. Okay? CBC is documented as the white blood cell count, hemoglobin, the hematocrit, and the platelets. This is your standard documentation in terms of your data. Other data that will belong in here is the chest x-ray, which of course you will read yourself, the ECG, blood cultures, any and all other tests that are run, blood tests, etc. The next piece of the note, and arguably the most important, is the assessment. The assessment itself should be 2-sentence on the patient. So 65-year-old male with diabetes, DM, diabetes mellitus, who presents with abdominal pain, so essentially who he is, what's his major history, what happened, what he presented with, and then what happened, who is post-op date 1 from exploratory laparotomy. So that one particular sentence conveys a lot of information, and it gives you a sense of why the patient is here and what your potential assessment is. And then obviously a little bit more detail would be helpful. And then the next part of the note is the plan. And the plan conveys what you're actually going to do. Occasionally people will lump the assessment and the plan together. I like to separate the assessment and plan, and I like to do the plan by systems. So by systems I mean number 1, neuro, number 2, cards, number 3, renal, I think you get the idea, number 4, pulmonary, number 5, ID, number 6, GI, number 7, heme, number 8, rheumatology, number 9, psych, 10, the bundle, so DVT prophylaxis, ulcer prophylaxis, etc. And then it's always nice to know where the patient's potentially going to go. So 11 is disposition. Home with services, etc. If you do your plan systematically in this way, if you don't have any issues, you write no issues. But if you write it systematically in this way, you'll remember that the patient has a psych issue, or has an ID issue, or has a pulmonary issue, or a renal issue, or you'll actually look at the data and think about these particular things. That is the SOAP note, S-O-A-P, the SOAP note in a nutshell. You will get good at writing these, you will get fast at writing these, and it's an effective way to communicate the data and your interpretation of it.